Welcome to the Canadian Dietitian School. I am your fairy instructor, Tesh Varagus. I create content for dietetic interns, new dietitians, and dietitians looking to learn new skills. For those of you who might be watching who think you want to be a dietitian, or those of you who aren't sure what to expect during your acute care rotation of your internship, I wanted to share with you what I do as a clinical dietitian in acute care. My days as a dietitian in acute care have lots of variety. Because no two patients are the same, no 2 days are the same. I start my workday between 7:45 and 8 o'clock a.m., and one of the first things I do is review my caseload and plan my day. I will review the list of patients who are admitted to the unit that I'm responsible for covering. I start with the first part of the nutrition care process, screening. I screen my patient list for patients at risk of malnutrition. I also make sure to consider the patients whose care I'm already involved with and determine when they next need follow-up. Patients who are tube-fed, also called enteral nutrition, or fed through an intravenous line, also called parenteral nutrition, are prioritized first. I often attend rounds for my unit. This is where the multidisciplinary team gathers and discusses every patient on the unit to ensure all team members are on the same page. Depending on the unit, rounds may look like team members sitting around a table in a meeting room, or they could be bedside rounds, where the team walks around the unit to stop with each patient. I will discuss any changes to the patient's nutrition plan during rounds, collaborate with my team, and listen to what they say to continuously screen nutrition risk for patients I'm not involved with, but maybe need to be. I spend the bulk of my day reviewing patient charts and meeting with patients. This is the assessment and intervention components of the nutrition care process. Reviewing the patient chart and speaking with the patient is very important, as I need to understand their medical history, blood work, medication, weight changes, recent intake, and several other factors in order to get the big picture for their nutrition status. When patients are on tube feeds, enteral nutrition, or PN, parenteral nutrition, also known as IV nutrition, I will spend time doing calculations to ensure that I'm meeting their nutrition needs. I often need to think critically to ensure that I'm doing the right thing. I can enter orders for diets, nutrition supplements, tube feeds, and parenteral nutrition. Calculating EN and PN and monitoring response to starting nutrition provision is one of my favorite parts of being a dietitian. Throughout any type of nutrition planning, I involve the patient, their family members, and other members of the care team, such as doctors, nurses, speech-language pathologists, pharmacists, and any other professional who needs to be involved. Communication with the multidisciplinary team is a huge part of my role as a dietitian. When I'm done seeing all of my patients and entering relevant orders, I have to complete documentation, also called a chart note. Charting is an essential part of being a clinical dietitian, as we must document all parts of the nutrition care process: assessment, nutrition diagnosis, intervention, and the plan for monitoring and evaluation of our intervention. While most of my day is spent working directly with patient care, I may have other things in my schedule, such as team meetings with my fellow dietitians and manager, or project meetings if I'm working with other dietitians on any projects. Most days are busy, and managing my time and knowing what tasks to prioritize is really important. Some days the workload is very heavy, and I have to catch up on lower priority tasks on another day. Other times, the pace is easy. I will ask my colleagues if they need any assistance with their workload, and I may even have time to attend a webinar or read journal articles for ongoing education.
The acute care world can be fast-paced and exciting. Seeing patients get better, in part because they're being nourished, can be really rewarding. If you like being busy, challenged, and seeing something new every day, working as a dietitian in the hospital may be good for you.
How big its ears are!